All right, I think we are live.
All right, thanks, Raina.
I'm going to start admitting everyone to the meeting.
Perfect.
Welcome, everyone. It looks like everyone that was in the waiting room is either joining now or is already on the call. So I'm going to allow Jen to take over. But before we start, just a couple of housekeeping items. We are recording this webinar, and we are also live broadcasting it on YouTube. In addition to that, because we are using a Zoom platform, if you are not presenting, please mute yourself, and in the event that you are using your phone, you can utilize *6 to mute and unmute yourself when asking questions. Feel free to ask questions via the Zoom platform, or if you're watching on YouTube, there's also an option to submit questions in that fashion as well. I will hand it over to Jen as your moderator.
Thanks so much, Raina. Appreciate it. Good afternoon, everyone. I'm excited to be here today. My name is Jennifer Skacco, and I'm a Special Projects Coordinator with the Department of Behavioral Health Services. In recognition of May Mental Health Month, the department is hosting a weekly web-based webinar to meet community providers utilizing the Behavioral Health Initiative that help create a safety net of supports in our community. Today, we are joined by organization leaders who provide prevention, intervention, and harm reduction services to reduce substance use and severe psychiatric distress through early identification and treatment. This will give you and the audience an opportunity to learn about the great work being done in the community and how supports from the BHI are assisting with that effort. So please join me in welcoming our first presenter, Diana Lopez, who is the Vice President of YDI and their Prevention, Intervention, and Behavioral Health Division. And she is here to speak with us about the newly established community engagement teams. I'm going to turn it over to you, Diana.
Thank you, Jennifer, and thank you to Bernalillo County and my colleagues for this opportunity to share. We're very excited about this. As Jennifer mentioned, my name is Diana Lopez. I'm one of the vice presidents here at Youth Development Incorporated, and we are extremely excited to introduce to the community our newly Bernalillo County BHI funded program, Community Engagement Team. And I'm going to just share a little bit of information about the program. We are brand new as of a couple of months. We did go live April 15th. And I'll share that in a later slide, how to make a referral and the phone number, because we will be accepting referrals 24 hours a day, 7 days a week. Next slide, please, Jennifer. As I mentioned, the Bernalillo County Community Engagement Team program is brand new to YDI, although we have been involved in doing a number of crisis stabilization initiatives throughout the years. YDI itself has been in existence since 1971, but this is a brand new initiative for us. And we are going to be providing services for individuals that includes children, youth, young adults and families that are experiencing a crisis situation due to behavioral health or any type of substance abuse challenge or issue. As I mentioned earlier, the CET will accept referrals 24 hours a day, 7 days a week. And the primary focus of CET is to assist the individual that is being referred in stabilizing their current situation. So it doesn't escalate to a point where they wind up in the emergency room of a hospital, or they wind up into a higher level of care, or they wind up, incarcerated. So we are really hoping to provide these services to help these individuals stabilize. We anticipate that we will be accepting referrals from a number of entities, which I'll describe in just a few moments. But let me talk a little bit about the staffing for the CET. The staffing for our program includes one full-time clinical supervisor who will be independently licensed. We are currently recruiting for this position, and I'm sure, as my colleagues well know, it's been a little bit of a challenge with workforce for clinical therapists and for clinical supervisors, especially independently licensed individuals. But we are recruiting for that position. Right now, our current clinical director, Tara Gutierrez, is acting program director for this initiative, and she is actually the holder of the 24-hour cell phone right now. We also have one full-time intake MIS manager who has been hired, and we will also have 3 peer support workers. All of these are full-time positions. Our peer support workers have been hired. We have 2 that are currently on board, and the 3rd individual is going through orientation next Monday and will be on board with us. As we see in the next couple of slides, the peer support workers are really the hub of this program, of the CET program. So we're very excited to have these staff positions. They will be certified through the state Department of Human Services, Behavioral Health Services Division's Office of OPRI, which is the Office of Peer Recovery Engagement. And they will be going through intensive training to become certified peer support workers. We are also currently recruiting for a PhD level prescriber, either a prescriber that is a clinical psychologist or a psychiatrist, and we have a couple of leads on that. This is for individuals that will need medication management or medication review. It's critical that a prescriber be available to be able to provide that assistance to any clients that are referred to us. Next slide, please, Jennifer. I'm so grateful Jen is doing that, because I could not multitask this.
There you go.
Thank you. I pretty much already mentioned this, but just to reiterate, once a referral is made, right now during regular business hours, our intake MIS manager will handle those referrals. But then they immediately get triaged, and then a peer support worker will then be assigned. After hours, during the evenings, weekends, holidays, we will have each of the full-time staff will be on call, and they will take turns being on call over a week's period. And then they will have their 24-hour cell phone specific to this project with them, so that we will be able to handle any after hours referrals and calls that come in. But once the referral is triaged, one of our peer support workers will be assigned to meet with the client that is being referred. I should mention that individuals that are referred that will be considered primary clients, and these are individuals that are themselves experiencing the crisis situation, and family members that are involved with these individuals, or a support system, anyone that the individual may identify as a support system, are considered secondary clients. So they will also receive ancillary services as part of our holistic approach, but the primary client will be the actual individual that is experiencing the crisis. And so, as I mentioned again, the peer support worker will be assigned, and they will make contact with the referral within a 24-hour period. If it is an emergent situation, then we will address that immediately. But definitely within 24 hours, we will have them preferably face-to-face. We anticipate that over 85% of the contacts will be made out in the community. And we know during a pandemic, it's a little bit challenging because we are a telehealth provider. But with individuals that are experiencing crisis, it's so critical to have that face-to-face and that warm handoff. And YDI's strength is in grassroots activities out in the community. So this is a program that very much fits into our framework. We anticipate that the majority of the work will be done out in the field through face-to-face visits. The peer support workers that have been hired are individuals who share the lived experience, as the county calls it, experience of living with mental health challenges and or substance use issues. So these positions, these staff positions are critical in that they can really relate to the individuals that are going to be referred to us and can share some of their knowledge, some of their support, some of the things that they went through and how they dealt with that. And we anticipate that this will really greatly enhance the service that will be provided. We also anticipate that the PSWs will work not only with a variety of community resources and families, but especially the mobile crisis teams that are already established out there through law enforcement, and they have their own licensed clinicians. And we actually have a meeting with the MCT teams tomorrow afternoon to start fleshing that partnership out. Next slide, please, Jen. This is a graphic that our Intake MIS manager did, and we feel that it's a good flow or shows a good representation of how we see the program operating. Again, the peer support worker, as I mentioned, is the hub or the center of the services once they get assigned. What I neglected to mention earlier is that it is short-term in nature. So we're looking at 3 to 4 sessions with the peer support worker. And then as the family or individual needs longer-term care, they will be referred on. It could be internally to YDI, one of our other longer-term programs, or it could be a partner agency, such as All Face, New Day Youth and Family Services, Centro Savila, a UNM program. So we have a broad array of informal and formal collaborative partners that as the needs of these individuals are identified and we identify longer term specialized needs, we will refer for that service. The PSW key ingredients to the work that they do is they connect people with resources. They will share knowledge. They will teach skills. How they could identify, how the client could identify predisposing factors or things that may be leading to a crisis situation. They will do crisis safety plans. Every one of our clients that receives behavioral health services through our agency has a crisis safety plan that is developed at intake. They will provide practical assistance, offer emotional support, and again, not just refer and do a warm handoff, but they will continue to follow up with a referral to make sure that the appropriate service is being provided to the individual. So they will be effective and working on service coordination. Next slide, please, Jen. How can we help? Well, I've already discussed this a little bit, but our peer support workers will link individuals with identified resources. I mentioned that these could be internally by internal referrals to other YDI programs or through collaborative partners. Crisis stabilization will be short in duration, no more than 4 sessions with transitions to other services. Again, this will be individualized. So if we have someone that maybe the peer support worker comes and says, I really need one other session, we will work with our county program manager to staff that case and see if that's appropriate. And then if they need 1 or more sessions, and then we can do a warm handoff for longer term care. I mentioned earlier that services, we anticipate most of the services will be out in the community. This could be in the client's home, a healthcare facility, any other community-based setting, a community center, a school, a hospital. These are places that traditionally our current community support workers and case managers and intervention specialists provide services out in the community. We've met with clients in parks, really wherever the client is comfortable and if it can afford privacy because of course, HIPAA and confidentiality, but wherever the client is comfortable and it's safe for both the client and our staff, we anticipate to be able to provide services in that environment. Services will include service coordination, peer case management, family support, and appropriate clinical services, which could include a mental health assessment, diagnostic assessment, and individual therapy, and perhaps family therapy in some cases. Next slide, please. Here are the important contact details. The 24-hour phone number for CET is 505-910-6357. We have also established an email address specifically for the CET program, so referrals can also be made through this, cet@ydinm.org. And then we have our website, which is open and available to anyone if you want more information on any other program that we may have, which is www.ydinm.org. We also have a link on the YDI website for regular behavioral health referrals that anyone in the community could access that form and make an immediate referral. But for immediate assistance through CET, it's the CET@ydinm or the phone 910-6357. And that concludes my portion of the presentation. Thank you again for inviting us and for the opportunity to serve our community.
Thank you so much, Diana. That was some great information about our CET program. And just a reminder, if you have questions, please put them in the chat or save them till the end, and we're going to be happy to answer them. So next up, we have Layla Demon, and Director of School Climate, and Juliet Beck from the suicide, who is a suicide coordinator with the Albuquerque Public Schools. And they're here to speak about the Office of School Climate Peer Helper Program at APS Public Schools. Welcome to Layla and Juliet. Thanks for being here today.
Thanks, Jennifer. It's so nice to be here this afternoon. Hi, everyone. My name is Layla D. Heeman, and I am the Director of School Climate here at APS.
Hello, everyone. I am Juliet Beck, and I am the Suicide Prevention Coordinator on the APS School Climate team. Let's see. So next slide, please, Jen.
All right, so just a little bit about the School Climate Department here at APS. So we're a fairly new team. We've been in existence for going on our 3rd year. And so what we on the School Climate team do is we support a lot of the behavioral health initiatives here in APS. So we are housed within the counseling department here at APS. And the things that we focus in on is training and technical assistance around restorative practices, social emotional learning, suicide prevention, bullying prevention, and we also provide crisis recovery whenever we do have a crisis in our district. So there is a link there to our APS Google website that goes in and provides a lot of amazing resources that we've developed or that we've found. So please do go and check that out on the web. Next slide. So just a little bit about the founding of our grant. So what we found was that there was a really strong need to bring more awareness and to decrease the stigma around mental health and suicide in our schools. And so about 2 years ago, we worked tirelessly to write this grant and get awarded. Thank you so much, Bernalillo County. Obviously, we could not do this amazing work in our 21 schools without the support of Bernalillo County. And so we are now in 21 schools, and we'll talk a little bit more about what exactly our program does and the amazing stuff that our peer helpers, all of our students, are doing within our district. Next slide.
So we, like Layla mentioned, we have peer helpers at 21 APS sites. We currently have 11 middle schools with peer helper programs and 10 high schools with peer helper programs. And you can see that we are in all 4 of the zones. And you may see a school that you have a connection to on our list. And we'd like to give a special thank you to our amazing peer sponsors at each of the schools. Our peer sponsors are, some of them are counselors and some are teachers, and they are doing this extra work with their awesome peer helpers in their school communities. Next slide, please, Jen. So just kind of an overview of the Peer Helper program. So we have, like we mentioned, the Peer Helper programs at 21 school sites, and we have 1 or 2 peer sponsors who are trained in suicide prevention, positive youth development, and peer helping skills. And then students at each school nominate students that they see as honest, trustworthy, and caring. Those nominated students are invited to join and become peer helpers. And we are adapted from NMDOH's Peer to Peer Helper program. And the premise of this is that we know that when young people have problems, they most often turn to their friends for help. And so there's this informal helping network within schools. And with our peer helper program, we're able to provide training to our peer helpers and our peer sponsors. Like Leila mentioned, we really work on breaking stigma. We focus on the warning signs and resources for suicide prevention, leadership skills, peer helping skills. And then within each school community, the peer helper programs do a monthly outreach, and then also 2 large service learning events for the community focused on suicide prevention. And then we also really make sure that our peer helpers know when to reach for outside help, right? So they know to always have their resources available, their sponsor, the hotline numbers, and so that way our peer helpers are also always supported. I think we're ready for the next slide, please, Jen.
All right. So some of our goals when we wrote this grant and as we've continued to develop this program here in APS have been our primary short-term goals are really that increased awareness about suicide and mental health, right? Going back to breaking that stigma. How do we bring awareness? And we're really focusing in on awareness on multiple levels, right? Because this is youth-driven work, it's really about bringing awareness to our youth. As we've developed this program, what the youth have done is really work to educate and bring awareness to the larger community. So not only within their own groups of other young people, but also to bring awareness to educators in the schools, to bring awareness to parents and community members. And so they've really acted as strong advocates and activists through this work to bring that awareness on multiple different levels. As far as our long-term goals, obviously we want to improve the quality of life. We want to reduce suicidal ideation in our schools. And we also want to just make sure that our kids are getting those services, right? And so through this connection between district and school, we're able to show and just even reduce some of the barriers of kids just getting access to service because they're becoming more aware of what we offer at the district. And so they know how to get their friends the support and help that they need, but also how to get themselves the support and help that they need. And even outside of the district, how to connect with all of these fabulous community organizations that provide services. And so we really do see this large social impact. And even going back to some of the other work that we do within the school climate department around social emotional learning, right? And restorative practices and conflict resolution and positive youth development. And so how do we create opportunities to provide training and education around these other types of social skills for our young folks. And so even just these, peer attitudes and how do we be good community members while also breaking stigma and helping people. And so it has been really beautiful to see what our students are doing in order to educate and to communicate with the larger community around these issues. Juliet, is there anything else that you want to add around goals?
Well, I think that's a great transition to the next slide. And I hope we'll have a little bit of time to share some of those really great outreach activities. Thank you. So for training, we are really, really appreciative to some of our national training connections and then also local. We work with the Trevor Project. Trevor Project has an amazing training that's free called the Lifeguard Training, and it's part of the American Federation for Suicide Prevention's best practice for suicide prevention. So both of our peer helpers and our sponsors complete the lifeguard training. We also connect with Erica's Lighthouse. Erica's Lighthouse is a depression awareness empowerment program. And what's really wonderful about Erica's Lighthouse is they have their curriculum split into age groups. So there's a middle school training and there's also a high school training. We also are so appreciative and thankful for our partners at New Mexico Department of Health, Office of School and Adolescent Health. They have created wonderful training in positive youth development and leadership, and then also Prevention New Mexico for suicide prevention. And then we are excited to be working with Envision Your Future for additional training and support for peer sponsors and peer helpers in the future. Next slide, please, Jen. We also absolutely love this resource. New Mexico Department of Health, Office of School and Adolescent Health has showed this, and it has taken off. What in the pre-pandemic, these stickers were a very hot commodity for the back of yearbooks and on classroom doors and on planners and agendas. And some of our peer sponsors started using this in their email signature line. So it now has a new life online because we do want to remind people that there are resources out there that are available 24/7. We have the Suicide Prevention Lifeline, the Trevor Project Crisis Hotline, and then also the Crisis Text Line. We know sometimes it can feel really overwhelming to make a phone call, and sometimes it can feel a lot better to just make a quick text. So that 741 crisis text line is another really wonderful resource. And when Layla was talking about how our youth are coming up with such amazing activities and ways to reach out to the community, I just wanted to share a couple of those. It's been so awesome to see the creativity of our peer helpers. We've seen things from postcards with artwork, original artwork being mailed to new students, to returning students. We've had, with this return to in-person learning, peer helpers doing sidewalk chalk, welcome back artwork. We've had all kinds of wonderful online trainings and outreach led by peer helpers to remind everyone that they are not alone, and a lot of inspiring kindness campaigns, which has just been so inspiring to see the kindness that spreads and just the wonderful work of our peer helpers in the community. And I think, Jen, you may have to tell me if this is our last slide. I think that it is. Yes, our contact information. Thank you, Jen. So yes, we have both Layla and myself, our email and contact information. And then we also just wanted to, again, thank our partners with Department of Health. We have Tessa Medina Lucero, who is our positive youth development coach, and also Joanne Sartorius, who is with Prevention New Mexico and has provided some really creative, clever virtual suicide prevention trainings for youth. And then just again, thank you to Bernalillo County and the Behavioral Health Initiative for supporting this work. And Layla, I'll turn it over to you. Thank you.
Again, thank you so much for having us. If there are any questions that anyone has, please do feel free to reach out to us. We love sharing information and resources that we get to share with our schools. So if there are any questions, just shoot us an email. We'll be happy to help.
Thank you so much, Layla and Juliet. That was a wonderful presentation and lots of inspiring work going on in our schools around the city and the county. Exciting stuff. So next, excuse me, next up, we have Juliet Kincaid Black, and she is the Director of Clinical Services with All Face Children's Advocacy Center. Excuse me, I just got a frog in my throat. And she is here to talk to us about parenting through the pandemic, which I think will be really exciting.
Thanks, Jennifer. I'm really glad to be here with all of you guys today. At All Faiths, we know that our entire community continues to be concerned about the health and well-being of the children in our community during this ongoing pandemic. As caregivers, I know that we are all facing difficult choices every single day. The good news is that no matter what choice you are making from one day to the next, you're already showing this greatness of conscientious parenting as you try to put your children's needs and safety first when there is no roadmap. So today, I'm going to try to give you a couple of tools that you can take with you at the end of this and begin using at home with your family. Next slide, please. The good news is that our children's ability to adapt is miraculous. It's really, adaptation is our greatest ability. And it's in times of challenge and struggle that we as humans really thrive. It's kind of hard to imagine now, but prior to World War II, almost all caregiving was done in the home. And that's where virtually all early childhood education took place. Childcare and group learning were actually seen as harmful to children's development. But in a relatively short amount of time, there was this great adaptation after so many women moved into the workforce and children figured out how to adapt. And it's because of all of that challenge and need to adapt that preschool was created. And today, as we know, group learning is our expectation and norm. So as we continue to face the current global crisis, our best child development experts are assuring us that as we adapt to this new challenge, our children are also adapting. We're also learning that children need only one attachment figure, good enough attachment figure, not perfect, and a small support group for the child and the caregiver in order to have adequate social stimulation. So what that means is that each one of you here today, you're already an important attachment figure to the children in your life. You're already giving all of the children you know the social stimulation they need. There are a couple of ways that we can maximize the quality connection between you and the children in your life. Next slide, please. So, play is the primary language for children 5 years old and younger. It's how children communicate their feelings and make sense of the world around them. And even after kids have a firm grasp on language, play is still a powerful learning tool. It helps children learn to plan, how to organize, and very importantly, how to regulate their emotions. And when you play with the children in your life, both you and the child you connect with are benefiting from reduced stress, increased confidence, and increased empowerment. So play offers a low-risk place for children and grown-ups alike to explore new skills, how to solve problems, how to manage conflict. During times of increased stress, we all need more play, not just the young kids in our lives. Next slide, please. The other big challenge I know many of us are struggling with at home is how to manage the increased conflict inside our houses. Or maybe I am just outing myself right now. At All Faiths, we use the Nurtured Heart approach in all of our services. The Nurtured Heart approach offers us some really clear steps to managing our own energy and focusing on what's going right, even in the midst of conflict. There are 3 stands or goals in the Nurtured Heart approach, and I'm just going to go over them really briefly. The first one is giving absolutely no energy to the negative. So if you imagine that you are a battery, like the one in this image, you want your battery level to be at 0, like the red battery icon, around the negative things that are happening, like your student at home refusing to do their homework, or your 5-year-old having the world's most epic meltdown in the parking lot because they don't want to wear a mask into the grocery store. The second goal is saying absolutely yes to opportunities to energize success and positivity. So you want to be the green battery icon in the picture when things are going right. If your student at home refuses to do their homework, but they do attend class every day, do you want to energize that success? Absolutely, yes. The goal is to focus on what's going right. Next slide, please. So don't wait until something is going wrong to recognize the people in your life and in your home. Everyone loves to be recognized. Even my dog loves to be recognized, and she will sit down and perk her ears up and her eyes are directly on me when I talk to her in my loving puppy voice and say, I see that you brought your stuffy back inside the home from outside without being reminded. And then her tail is wagging. So if she can get that much good energy from me just recognizing her for 15 seconds, imagine all of the amazing stuff that's happening to the people in our homes and in our families when we just tell them what we see happening that's going right. And there is not one right way to recognize your children and your loved ones. I'm inviting you to practice with them tonight. What do you see them doing? If your teenager comes to the kitchen when you call them to dinner, recognize that. Or if your kindergartner erases a mistake on her spelling homework and just keeps going, energize that. Name the things that you see, because that's powerful energy. Next slide, please. The third stand to the Nurtured Heart approach is to be absolutely clear with your rules and expectations and with enforcing those rules and expectations. Basketball is a really great way to illustrate how absolutely clear can help reduce conflict at home. And I have to be fully transparent. I've never played a game of basketball in my life. So everything I've learned here is from those who love sports around me. What I do know is that there's not a single person alive who doesn't know what the lines on the court mean. Everybody knows that there is a playing zone and there's an out of bounds zones. And the players run up and down the court, dribbling and passing and shooting. And the refs run up and down the court with them. And if a player steps out of bounds, the ref blows the whistle, the other team gets the ball, and the game continues. What you don't see is the ref running alongside the player saying, watch out, you're pretty close to the line. You're almost out of bounds. Why aren't you listening to my warnings? I'm trying to tell you here. And when the ref blows the whistle, you don't see the players arguing and negotiating. Come on, ref. It's the first time I've been out of bounds all quarter. Just give me a break. Just give me this one time. Everybody knows the rules. A toe over the line is a toe over the line every single time. Perfection is not required here. That is the magic of being absolutely clear. Even following these 3 stands, though, conflict is bound to happen. We need only go back to our own worries about the pandemic to understand that every morning when we wake up these days, we're already keyed up. Our thinking brain is already compromised by the impact of trauma, which means our flight, freeze, and especially our fight response is primed and ready to go. One of my favorite ways of managing this current reality is through the use of the reset. So growing up, I had one of those old school Nintendo game consoles, the ones where you had to walk across the room to press the reset button if you made a mistake while you were playing Tetris. I'm going to tell you how to use that old reset button to manage conflict at home. Next slide, please. A reset is meant to be brief. It's not hours or days of punishment. It's the ref blowing the whistle because that player stepped out of bounds. The player isn't kicked out of the game. She's just been reset so that she can keep playing. In the same way, when you notice your own energy is being pulled toward the negative and you and your kids are fighting about homework again, or the kids are arguing and throwing Legos at each other, enforcing a reset is an opportunity for everyone to pause and take some time to regulate. In that pause, a reset allows you to recommit to focusing your energy on the positive, to the rules that are not being broken. Next slide, please. So you are probably at the point where you're trying to figure out what play and conflict have in common. Here it is, you and your ability to stay regulated. So if you will look at this picture, the image on the left shows a regulated caregiver with the nice, cool blue brain. This caregiver is calm and relaxed, and so the thinking part of their brain is lit up and online. They can do math with their kids at the kitchen table and think about the grocery list and maybe, plan for their next business meeting. The caregiver on the right is experiencing big feelings: anger at the constant fighting, fear about the virus and their family's risk, love, hate, and other big feelings. This caregiver does not have access to the thinking part of their brain right now. When we're stressed out, we're not able to regulate, which means we're not able to play or to manage conflict. And right now, most of us are living on the right side of this image with our brains pretty hot from all of the big feelings we've got. So, focusing some intentional energy on caring for yourself as a caregiver is critical in order to stay in connection with your children. Next slide, please. We want to engage in activities that are going to fill you back up. Caring for others is like pouring water out of a pitcher. If you don't pause to refill your pitcher regularly, nobody gets any water. You probably had a number of activities that filled you up pre-COVID, such as hiking with friends or playing in the park or visiting your extended family. You are worth the time that it takes to identify new activities to fill you up during this time of heightened stress. And if you would like some help, either filling your own water pitcher as caregivers or supporting your children through all of this pandemic-related trauma that they're experiencing, All Faiths is here to provide you with a variety of mental health services that are focused on the children and the caregivers. Thank you.
Thank you so much, Juliet. That was excellent. I feel like we have lots of tools in our tool basket now to stay regulated and make some small changes. And again, thank you to all of our presenters today, our friends at YDI, our friends at APS. We appreciate that. Next, we're going to go see if we have any, I'm going to stop sharing, if we have any questions in the chat or from the members of our audience. And I'm going to see if Raina can't help me out with that. I'll take a look at the chat here. So I don't see any questions in the chat. If we do have any members of the audience that have questions in general or questions for specific presenters, please feel free to unmute yourself and go ahead and ask that question. Don't be shy. Just looking to see who we have on. A number of our staff joined us. Some of our other friends and colleagues. Okay, if we don't have any questions, I'm going to go ahead and ask a few questions of our panelists today to kind of explore a few more things. And we'll just kind of let them take turns answering. So the first question I have is, what impacts have you seen on behavioral health as a result of the COVID-19 pandemic? And what are your thoughts perhaps about long-term impacts that could be maybe positive or negative in the behavioral health landscape? Would we like to go to, who would like to go first, I guess, from our panel? Miss Diana, thank you. Go for it.
I'm probably going to need to ask you to repeat the second question, but because I already forgot it. But the first part, one of the things we saw with behavioral health outpatient was that referrals tended to drop, but the folks that were transitioning, because we went into lockdown, and of course we couldn't see folks either in their homes or in our offices, they adjusted and transitioned really well to telehealth and to telephonic. So we actually saw an increase in that, which was pleasantly surprising to me, because we were really worried we were going to lose quite a few of our clients when we weren't going to be able to do the traditional home visits or have them come to the office. And that really wasn't the case. We kept a steady flow, which was, I thought was really good. I think one of the other impacts is we do have a school-based program. And of course, the school, not having access to the school proved very challenging. It's interesting now with things opening up that our referrals, we just had a managers meeting yesterday afternoon, our referrals for outpatient have increased quite a bit. And then referrals at the school, because we are back on site at one of the local middle schools, have also increased. I think that might have answered the second question also, Jen, but so we're seeing that. So we will go back, of course, to community-based services. But if a family is comfortable and prefers telehealth, we will accommodate them that way as well.
Yeah, I think that was the second part of my question is, what changes do you think you'll make long-term as an agency as a result of the pandemic?
Definitely keeping the telehealth. Telehealth, yeah, that worked for us. And I think it will continue to work for some families.
I agree. Thanks so much, Diana. Would anyone else on the panel like to respond?
Yeah, I think that's a really great question, Jennifer. I would say there are a couple of trends we have noticed. The first one is the hot topic that brings folks in, that brings kiddos in particular, has the topic of school has really decreased. As they were doing all of their schooling online, the stressors related to school seem to be less present for kiddos, and then family stress really increased. And so just what we have been addressing in services has made a little bit of a shift. And then I agree with Diana that I don't think telehealth services are ever going away. I read this really interesting study that said providers feel very uncomfortable. We're quite sure we're doing everything wrong. We really second guess ourselves, and we think that we're being ineffective. And when clients were asked all across the age spectrum, how is this going for you? They all said, it's going great. I'm doing just fine. And so I think that has been some great learning for us as a provider community. How do we check the voices in our own heads and just trust that the clients in front of us are going to tell us what they need and what's going well and what's not going well. And so one of the things All Faiths has decided to do is expand the services that we're willing to offer, like far outside of Bernalillo, because we have seen that we can. And that's awesome, because it means that families around the state are going to be able to get some kind of support and resources even after this pandemic is over.
Wow, that's really interesting, Juliet. It's interesting to me to hear that therapists and practitioners really feel like it's going poorly, but families and parents and kids are like, hey, this works. So, and I'm super excited to hear about the reach statewide. I know I've sat on a couple this week, different suicide prevention meetings, and last week with the state and also with APS is hosting a youth suicide prevention collaborative. That's really interesting. And statewide, the lack of services are a huge issue. Juliet or Layla, do you want to talk a little bit about how I think one of the really interesting things about your program is that you were able to implement the peer helper program and have it all be online and have everybody be engaged and have everyone do this remote work and then even translate it to some really interesting remote events. I remember you guys sent me the YouTube video of the school that did the like online talent show, and there were so many crazy things going on. Do you want to talk a little bit about the successes with that and what you've learned?
Yeah, absolutely. And I think, if we're talking also about what we'll keep, I think a lot of our training opportunities that we did have to, everything had to move online. And so now we have this great platform to connect with each other and, bringing 21 employees, and technically we have 25 sponsors throughout our 21 sites. And so bringing 25 sponsors out of the schools to come to a training was going to be difficult, right? Commuting and doing it after hours and getting everyone there, especially when we have, 21 schools that are all on different bell schedules. And so now it's really easy for us to all just meet virtually and do our trainings virtually. And so I definitely do think that we'll keep that up. I know that many of our sponsors were very nervous at the beginning because how do we engage our kids, right? Just for class and then ask them to stay after school for an extracurricular program that is now also online. But luckily, so many of our students really wanted to connect. And so they made it a point to be a part of this program because they wanted to connect with other kids in their schools. And so we were able to, kind of get over those fears that we had as adults in order to make sure that the kiddos were having opportunities to connect with each other. And so I'll let Juliet talk a little bit about some of the really innovative things that students have done, even including with physical space, right? And so, we had one school that built a garden in their school, and so it's a Peace Zen garden, and they did it all COVID safe, socially distanced. But lots of great things happening.
Absolutely. We have just been so impressed with the creativity that our peer helpers have brought to this program. We've had everything, Jen mentioned there was a school that did a hot sauce challenge, and we've had schools who made Flipgrid mixtape videos that shared self-care. We've had one of our high schools interviewed the New Mexico Crisis and Access Line with how can it help their community more. There have been virtual poetry slams and art events. And, I think some of the freedom that comes with that digital platform is some of our students who might be nervous about going somewhere in person or being on stage, right? That can always be a little nerve-wracking. Maybe it's a little less intense if you're able to submit your artwork ahead of time or pre-record yourself. So it can remove some of that anxiety and nervousness, and then just really give everyone a space to shine and give everyone a chance to be seen and support each other. So when you asked the question, Jen, the word that came to mind for me was creativity. We have just seen so much awesome, fun, unique creativity. We even had a school, I mentioned the hot sauce challenge, they even had a baking challenge using the colors for Suicide Prevention Awareness Month. So it's just been a really wonderful experience to see the creativity.
Awesome. Thank you so much, you guys. Well, I think our time here today is just about over. I want to again thank all of our wonderful community providers for being such excellent partners to the BHI and the county and providing services in our community. We really do appreciate the hard work that you do, and especially the hard work that has gone on during the pandemic to continue to deliver services. We will be back here again next week, and we will have another set of providers from the Behavioral Health Initiative come and give a presentation. So if you've tuned in this week, we hope you'll tune in next week. We will be here every week this month for May Mental Health Awareness Month. There's lots of great activities going on our website. I know the state's got a lot of great activities going on. So please tune in this month. And Miss Raina, do we have anything else we need to add to the ending here?
Thank you, everyone. Just want to echo Jen's sentiment about the work that you guys are doing. At this point, I think we are good to go. Once we wrap up, I will close out the session, which will stop the live link. And as Jen mentioned, there'll be upcoming events, and so we can send out information to this group about those upcoming events. And please feel free to participate in all or one. Thanks again.
Awesome. Well, thank you so much, everybody, and we'll see you all soon.